Hi, this is Jenny Lynn of theopenmindtherapist.com talking to you about chronic fatigue syndrome and how to treat it. So your clients come in, you've listened very carefully, you've heard some things that indicate that they're having to behave and be something for somebody else, that there's almost like they're afraid of what other people might think, and this is what you're listening for. Now there's lots more to this, obviously there's lots more. I've got a whole training package on how to treat cfs.co.uk, and there's a whole load of information on there. So what are you listening for? What do you do next? What do you do next? Okay, the next thing you do is you reflect and you summarize and you show your client that you've really heard them. And I'll tell you why. Chronic fatigue patients, clients, have been round the block trying to convince people they are ill. And the operative word is try, because the majority of people don't believe. And in particular, the medics sometimes really don't get it, because they can't measure it, they don't know what it looks like, it hasn't got a pathology, they don't know how to deal with it. So they've been everywhere trying to convince people they're ill. Their lives have been completely decimated by fatigue, they can barely move most days, and yet no one believes they're ill. They think it's all of this, it's all in the head type thing. So the first thing you can do is really validate them by reflecting what they've said to you and summarizing. Okay, tell them that you hear them, ask questions to encourage them to tell you more. When they say, do you believe me? Most people don't. If they say that, say, of course, why wouldn't I? So you really need to validate their experience and really get them to see that you really have understood or felt or had a flavour for what their life must be like. Okay, so that's a really important thing, because until you've shown that you don't have to be convinced, they will keep trying to convince you and convince you and convince you, because that's what they've always done. That's what they've had to do. However long they've been ill, that's what they've done for a long time. And there's nothing worse than having to convince somebody that you're ill when you know you just can't move. So I think somewhere in my travels, over the last 10 years since I've been working, longer than that, 13, 14 years since I've been working with chronic fatigue syndrome, has been, how can I get well when I have to convince somebody I'm ill? So it's almost like, how can I convince anyone that I'm ill? This is the problem. So you're just listening and you're validating and you're summarising and you're reflecting, and your empathy is going to just really help. If you get tears, if they feel tearful at that point, just sit quietly and hold the space, yeah? Because that's what they need. Okay, so it's Jenny Lynn from The Open Mind Therapist, and I'll talk more about chronic fatigue shortly.